after weeks of closed-door, one-party negotiations among senators, all Republicans, they've finally released their proposed changes to the Affordable Care Act. It's not much different, unfortunately, than the bill that passed the House. We don't have an analysis yet because it was just released and they want to vote on it next Tuesday. They've had not a single hearing, and obviously no one really knows what's in this bill yet. The House bill would have made 23 million Americans over the next 10 years lose their health insurance, and would have dramatically increased costs for seniors and others. So this bill is not going to be much different. It probably puts off the date at which people lose their health insurance, but as I understand it, actually is going to take away health insurance from a larger number of people. In particular, people who are on the Oregon Health Plan, extended Medicaid, those people are at risk. In Oregon, there's 450,000 people whose health care is at risk under this bill. There are 30,000 seniors in long-term care, which is paid for by Medicaid, and they're going to cut the heck out of Medicaid. So that puts those 30,000 people at risk. More than 7,000 people from my district have contacted my office to say they are opposed or very concerned about this proposed legislation. And it's about one thing. It's not about health care. It's not about improving the Affordable Care Act. If it was, I'd be enthusiastic, because I believe the act needs a lot of improvement, particularly a national not-for-profit plan that would give people less expensive insurance across state lines. It's about one thing: cutting taxes for the richest among us. This will repeal a tax that only applies to income over $200,000 a year. So a person who earns $200,000 to $500,000 a year gets a $4,740 tax break under the Senate health plan. Those earning more than $1 million, they get a $54,000 tax break. And then the 0.1%, those earning over $3.75 million, mostly on Wall Street, they get a $195,610 tax break. They are delivering tax breaks to the wealthiest among us under the guise of reforming and improving health care. It's a dirty, rotten lie.